Now that you understand where outer hip pain is coming from, the next question is, how do you know if gluteal tendinopathy or hip bursitis is actually what's causing your symptoms? While no single symptom can definitively diagnose this condition, there are several common patterns that physical therapists look for during an evaluation. In this video, we'll discuss the most common symptoms, where the pain is typically located, what activities tend to make it worse, and when your symptoms may suggest another condition altogether. Symptom number 1 is pain and tenderness on the outside of the hip. The hallmark symptom of gluteal tendinopathy is pain directly over the outside of the hip. Most people can place 1 or 2 fingers directly over the bony prominence called the greater trochanter and say, "This is exactly where it hurts." Early on, the pain is often very localized. The area is typically very tender to touch. Pressing directly over the greater trochanter often reproduces the familiar pain almost immediately. During a physical therapy evaluation, this tenderness is one of the most consistent findings. As this condition becomes more irritated, it may begin to spread down the outside of the thigh. Which brings us to symptom number 2, which is pain that travels down the outside of the leg. One of the biggest misconceptions is that pain traveling down the leg automatically means sciatica. Fortunately, that's not always the case. Gluteal tendinopathy commonly causes pain that begins on the outside of the hip and radiates down the outside of the thigh. In some people, the discomfort may even extend towards the outside of the knee. This happens because irritated tendons can refer pain into nearby areas, even though the tendon itself is located at the outside of the hip. Because of this, gluteal tendinopathy can sometimes be mistaken for a lumbar spine problem. One of the biggest clues is where the pain starts. With gluteal tendinopathy, the pain almost always begins on the outside of the hip, and activities that load or compress the gluteal tendons, such as lying on the affected side, climbing stairs, prolonged walking, or standing on one leg, tend to reproduce the symptoms. Lumbar radiculopathy or sciatica, on the other hand, follows a different clinical pattern and may be more influenced by movements of the lumbar spine, such as bending, standing, prolonged sitting, coughing, sneezing, or lifting heavy items. One of the biggest clues with lumbar radiculopathy is that it will not be painful to touch on the outside of the hip. And oftentimes, patients with this cannot seem to feel a tender spot where the pain is coming from. However, there can be a significant overlap between these conditions, and it's possible to have both at the same time. That's why the entire clinical picture, not just where the pain travels, is important when determining the source of your symptoms. Symptom number 3 is night pain and difficulty sleeping. One of the most frustrating symptoms of gluteal tendinopathy is pain at night. Many people tell me that daytime activities are manageable, but once they try to sleep, the pain becomes much more noticeable. Sleeping directly on the painful side places prolonged compression on the irritated gluteal tendons and bursa, which can significantly increase symptoms at night. Even sleeping on the opposite side isn't always comfortable because the painful leg often falls inward, also placing the gluteal tendons under additional compression. Many people find themselves constantly changing positions throughout the night or waking up because of hip pain. The good news is that simple changes to your sleeping position can often make a significant difference, and we'll discuss those strategies later in the series. Symptom number 4 is pain with single leg activities such as walking, stairs, and hiking. The gluteal tendons help stabilize your pelvis every time you're standing on one leg. Since walking is essentially a series of single leg balances, these tendons are constantly working. As a result, symptoms often increase during activities such as walking longer distances, hiking, climbing stairs, walking uphill, carrying heavy objects, running, or even simple activities such as putting pants on or standing up from a chair. These activities all increase the demand placed on the gluteal tendons, making them common aggravating factors. Patients often tell me they're surprised that such ordinary tasks can become so uncomfortable. Some patients even describe feeling fine at the beginning of an activity, such as a walk or stair climbing, only to notice the pain gradually building as the tendon becomes more irritated. Now that you know what this condition typically feels like, the next question becomes, how long does recovery usually take? In the next video, we'll discuss realistic recovery timelines, why progress isn't always linear, and what you can expect throughout the rehabilitation process for outer hip pain.